Hi children, good morning. Last session I have discussed about various contraceptive methods given by our government. Under this we have discussed about temporary and permanent birth control methods, and now I am going to discuss with you about the medical termination of pregnancy and various sexually transmitted diseases as causative agents, symptoms, incubation, and some introduction of infertility. Alone, I am going to discuss with you. Next class, I will complete this lesson, hope. And after that, we will enter into botany lessons. Okay, children. So, what is medical termination of pregnancy? See, medical method of abortion of voluntary or intentional termination of pregnancy in a non-surgical or non-invasive way is called what? Medical termination of pregnancy. In short form, it is called MTP. Okay, so that is abortion of fetus, either voluntary or intentional termination, okay, by non-surgical or non-invasive way, and this is called what? Medical termination of pregnancy. And then children, during the development of fetus, there are three trimesters are there, isn't it? First trimester, second trimester, third trimester. Among this three trimester, the first trimester period, that is up to 12th week of pregnancy, is safe to do the termination of pregnancy. Okay, when you go for second trimester, it is not easy one, it is a risky one. Why? Because the fetus tissue is intimately associated with the maternal tissue in the uterus. Okay, and it leads to many consequences to the maternal body. Okay, that's what it is not advisable to go for pregnancy after the first trimester period. And government also legally allowed to do the medical termination only in such conditions, that is some illness or some social consequence, the couples can go for medical termination. But in intentionally to abort the female fetuses, they should not go for abortion. Okay children, so and also abortion with illegally with an experienced person leads to fatal effect also. Fatal means what? It leads to death. So these are the these are the effects of medical termination or a medical termination of pregnancy. Okay, see, let's enter into the text children. Medical method of abortion is a voluntary or intentional termination of pregnancy in a non-surgical or non-invasive way. This is a definition for medical termination. Then when have to do this? Early medical termination is extremely safe up to 12 weeks, the first trimester of the pregnancy, and generally has no impact on a woman's fertility also. Abortion during the second trimester is more risky as the fetus becomes intimately associated with the maternal tissue. That's what I said, isn't it? So why the abortion in the second trimester period is not advisable? Justify your answer. You can give the answer that it become the fetal tissues become intimately associated with the maternal tissue and leads to risk of the mother's body. That's what abortion during the second trimester is more risky. That's the answer for that. Government of India legalized MTP in 1971 for medical necessity and social consequences with certain restriction like sex discrimination and illegal female feticides to avoid its misuse. Okay, then MTP performed illegally by unqualified causes is unsafe and could be fatal. MTP of the first conception may have a serious psychological consequences also to the couples. Next, we are going to see about a sexually transmitted disease. Children, under this, we are going to see many diseases. Okay, actually, what is meant by sexually transmitted disease? It is nothing but the infections caused due to intimate sexual contact with the infected person. It is called what? Sexually transmitted disease. It is otherwise called as venereal disease or reproductive tract infection also. So as I said, this sexually transmitted disease normally transmitted through intimate sexual contact with the infected person. Okay, what are the what about hepatitis B and HIV? Infections like hepatitis B and HIV are transmitted sexually as well as by sharing the infusion needles and surgical instrument etc with the infected people. When you sharing the infected needles, surgical instrument with the infected people, automatically will be transmitted to the healthy person. And also this disease transmitted from infected mother to fetus also through blood transfusion. Okay, and people in the age of 15 to 24 years are prone to these infections. Mostly the people which are in the age of 15 to 24 are more prone to affect with this disease. The bacterial, the see children, the sexually transmitted disease is caused by bacteria, virus, fungi and also protozoan. So here are some list given. What are the bacterial sexually transmitted disease, viral sexually transmitted disease and fungal protozoan transmitted disease also. Let's see about what are the bacterial sexually transmitted disease. Gonorrhea, syphilis, chancroid, chlamydosis and lymphogranuloma venereum or the sexually transmitted bacterial disease. And what are the sexually transmitted viral disease? Genital warts, hepatitis B and AIDS or the viral sexually transmitted diseases. And what about trichomoniasis? It is a protozoan sexually transmitted infection. Candidiasis is a fungal sexually transmitted infection. And STI caused by bacteria, fungi, protozoan or parasite can be treated with antibiotic, children or other medicines. But the sexually transmitted infection caused by virus cannot be treated with antibiotic or medicine. But the thing is, we can reduce the symptoms by antiviral medications. Latex condom usually greatly reduce the risk but does not completely eliminate the risk of the transmission of STI. So when a male partner use condoms made up of latex can reduce the risk, but it is not completely eliminate the transmission of STI. Next, prevention of STDs. What are the preventive measures to use to prevent the STDs? Avoid sex with unknown partner, multiple partners. Okay. Then second one is use condoms. Third one is in case of doubt, consult a doctor for diagnosis and get complete treatment. Okay. So these are the preventive measures of STDs. This is book back answers also. And let's see about this do you know paragraph. According to World Health Organization, WHO, 2017, as per 2017 census, more than 1 million people globally acquire sexually transmitted infections every day. India has the third largest HIV epidemic in the world with 2.1 million people living with HIV. Next, TNHSP, Tamil Nadu Health System Projects, a unit of the Health and Family Welfare Department of the Government of Tamil Nadu, does free screening for cervical and breast cancer. Okay. So let's see children, a table of various sexually transmitted disease and its causative agents, symptoms and incubation period. First, let's see the bacterial sexually transmitted infection. In that first one, gonorrhea. Gonorrhea, it is a sexually transmitted bacterial disease, is caused by Neisseria gonorrhea is the causative agent, and the symptoms of the disease are affects the urethra, rectum and throat, and in female the cervix also get affected. Okay, what are the symptoms? This is in the as per the first paragraph, it said about the parts which are affected by the gonorrhea. Okay, and the next paragraph, the symptoms: pain and pus discharge in the genital tract and burning sensation during urination, and the incubation period will be 2 to 5 days. Okay. And next disease we are going to see is what? Syphilis. Syphilis is caused by Treponema pallidum. It is caused by a bacterium Treponema pallidum. What are the infections? There are 3 stages of infections in or symptoms in the disease syphilis. We can see the first stage, the primary stage of symptoms are formation of painless ulcer on the external genitalia. And say, as per the secondary stage symptoms, skin lesions, rashes, swollen joints, and fever, hair loss. Tertiary stage of infection, appearance of chronic ulcers on nose, lower legs and palate, loss of movement, mental disorder, visual impairment, heart problem, gammas. What does mean by gammas? A soft non-cancerous growth, etc. So these are the various stages of symptoms caused by syphilis in a infected person, and the incubation period is very long, maybe take 10 to 90 days. Okay, next one is chlamydiosis. Chlamydiosis is caused by Chlamydia trachomatis. Trachoma affect the cells of the columnar epithelium in the urinogenital, respiratory and conjunctiva. So here the symptoms are not given in the chlamydiosis. The part which are affected by chlamydiasis alone given, that is, it affects the cells of columnar epithelium in the urinogenital tract, respiratory tract and conjunctiva. And lymphogranuloma venereum, it is caused by Chlamydia trachomatis. Okay, so both the diseases are caused by same parasite only, Chlamydia trachomatis. And the symptoms are cutaneous or mucosal genital damage, urethritis and endocervicitis. What is endo? Inside. Cervicitis, the infection in the cervix is called what? Endocervicitis. That is the infection inside the cervix might be. Urethritis, urethral infection irukum. Then locally harmful ulceration and genital elephantiasis have been taken place. And the incubation period 2 to 3 weeks or up to 6 weeks is the infection period, or what it is, incubation period. So far we have discussed about bacterial sexually transmitted infection. Now we are going to enter the viral sexually transmitted infection. Genital herpes, the disease caused by virus. It is caused by herpes simplex virus. The symptoms shows in and around the vulva, vagina, urethra. What is vulva, vagina, urethra in female? It is a external genital organs, or shows on or around the penis in male. And pain during urination, bleeding between periods, then swelling in the groin nodes. These are the symptoms of genital herpes. Okay, so then next, incubation period 2 to 21 days, average 6 days. And next, genital warts. It is caused by human papilloma virus. What are the symptoms as per this disease? Hard outgrowths, that is tumor on the external genitalia, cervix and perianal region. The symptoms of 1 to 8 months. Incubation period were taken for 1 to 8 months. Too long period for this disease. And listen children, human papilloma virus also causes cervical cancer in female. Human papilloma virus cause cervical cancer in female also. Next one is hepatitis B. Hepatitis B virus, it is caused by hepatitis B is caused by hepatitis B virus, and the symptoms of this disease are fatigue, jaundice, fever, rashes and stomach pain. Liver cirrhosis and liver failure occur in the later stage. The incubation period will be 30 to 80 days. Okay, and AIDS, human immunodeficiency virus, enlarged lymph nodes, prolonged fever, prolonged diarrhea, weight reduction, night sweating are the symptoms of this AIDS. And the incubation period 2 to 6 weeks, even more than 10 years also. So children, so far I have discussed about viral sexually transmitted infection. Hope you have clear. Next we are going to enter fungal STI. Okay, only one fungal STI given as per our syllabus, that is candidiasis. It is caused by Candida all begins. The symptoms of the disease are attacks mouth, throat, intestinal tract and vagina. And the symptoms are vaginal itching or soreness, abnormal vaginal discharge and pain during urination. And trichomoniasis, Trichomona vaginalis. The symptoms are vaginitis, greenish yellow vaginal discharge, itching and burning sensation, urethritis, epididymis and prostatitis. Urethritis, that is infection, inflammation in urethra, is called urethritis, and epididymis, that is infection in the epididymis. And next one is what? Prostatitis, that is infection in the prostate gland. So this is called what? Symptoms of trichomoniasis. Trichomoniasis is caused by protozoa. Next children, cervical cancer. As I said, genital warts also caused by what? Caused by human papilloma virus. So cervical cancer is caused by a sexually transmitted virus called human papilloma virus. Human papilloma virus may cause abnormal growth of cervical cells or cervical dysplasia. The most common symptoms and signs of cervical cancer are pelvic pain, increased vaginal discharge and abnormal vaginal bleeding. The risk factors for cervical cancer include having multiple sex partners, prolonged use of contraceptive pills. These are the two reasons. Okay, so you will have questions like, what is cervical cancer? Name the causative agent, mention its symptoms and factors for this cervical cancer. 3 mark question. So cervical cancer, it is a cancer caused by human papilloma virus. The symptoms of the cervical cancers are pain, pelvic pain, increased vaginal discharge and abnormal vaginal bleeding. And the factors for causing cervical cancers are having multiple sexual partners, prolonged use of contraceptive pills. Then cervical cancer can be diagnosed by a Papinocola smear test, that is we will say as PAP test in simple, combined with the HPV test. Then X-ray, CT scan, MRI and a PET scan may also be used to determine the stage of cancer. So what are the various diagnostic methods used to detect the cervical cancer? 2 mark question. See, PAP smear test combined with HPV test, then X-ray second one, CT scan third one, MRI scan fourth one, PET scan. So these 3 types of scans with the PAP smear test and X-ray are used to detect the cervical cancer. The treatment options for cervical cancer include radiation therapy, surgery and chemotherapy. Then modern screening technique can detect the precancerous changes in the cervix. Therefore, screening is recommended for women above 30 years once in a year. Cervical cancer can be prevented with vaccination. Primary prevention begins with HPV vaccination of girls aged 9 to 13 years. Okay, so here it is females have vaccines for this cancer also with the age of 9 to 13 years before they become sexually active. So before sexually active they should have this vaccination. Modification in lifestyle can also help in preventing cervical cancer. Healthy diet, avoiding tobacco usage, preventing early marriage, practicing monogamy and regular exercise minimize the risk of cervical cancer. Okay. So next one is what? Infertility, children. See, infertility we will discuss about in my next class. I'll give an small introduction about infertility. What is infertility? Inability to conceive or produce children even after unprotected sexual cohabitation is called what? Infertility. So it is nowadays it is became a serious problem in the young couples to have a normal conception. So for that infertility, many methods are developed in the modern technology. The various type of technology to have a child of couples will be discussed in my next class, children. Okay, so please take down the homework. Cervical cancer fully, MTP fully, and about genital herpes, viral disease, genital herpes, causative organism, symptoms, incubation period, and syphilis, causative agent, symptoms and incubation period. So these are the homework. MTP, preventive method of sexually transmitted disease, then syphilis and its symptoms, causative agent, incubation period, same way in genital warts, and then full cervical cancer. Okay, these are the homework for you, children. Complete it and keep it. Thank you. Bye. We will meet in my next session. Bye.